Cameron here, registered physiotherapist. Today I'd like to talk to you about the importance of spinal stability. I want to go through a couple exercises that from a research standpoint has been shown to provide the greatest amount of spinal stability. These are called the McGill Big Three. And also why instability in through the spine, why it can lead to pain. But before I continue, please hit the subscribe button below in order for you to be notified about any new videos I provide on my site here. So essentially, when we're talking about back pain, a big component of where back pain will come from is a result of the actual individual vertebrae moving too much, right? So there's a term called hinging, which essentially what that refers to is in the spine, there'll be very specific segments in which there's a shearing force that moves through that segment. So essentially when somebody does, let's say, a side bend, they bend forward, they extend back, the majority of the movement will happen in a very specific segment. So essentially there's too much movement in that area and not enough movement in the segments above and below that spine. So what will happen is when we're doing these dynamic movements, some of the more superficial muscles that surround that particular segment will basically go into spasm to provide some form of stability, right? In order to protect that segment. Now, the way that we allow these very superficial muscles called your paraspinal muscles to start to kind of let go and relax is by working on the deeper sort of core muscles that help to stabilize these individual segments. So as we get these segments stronger by working on strengthening these muscles that again stabilize the spine, all of a sudden, right, the more superficial muscles, they can start to let go and relax, and then there's not as high a degree of muscle spasm, so to speak, that'll happen as a result of this. So there's a researcher, his name is Stuart McGill, and he's done a lot of research on the relationship between spinal instability, pain, and the proper exercises to actually stabilize the spine in dynamic movements in order for this spasm, so to speak, to prevent it from happening essentially. So we want to work on minimizing this hinging, so to speak, that can happen. I also want to say that these exercises, they're for a very specific segment of the population in terms of back pain. So for example, some of these exercises, they might not necessarily apply to somebody who has, let's say, a disc herniation where there's peripheral symptoms, right? So in those cases, we really want to minimize any of the peripheral symptoms first before we go about trying to stabilize the individual segments. So in that case, we might have to bias a certain position, typically extension, in order to centralize nerve-related symptoms. So this is going to be for somebody who really doesn't present initially anyways with any sort of neurological symptoms where that's completely gone, and basically all we're dealing with here is pain as a result of certain segments hinging, moving too much, and we've determined, right, that what's going to help with this pain is to actually provide more stability again in through that segment to minimize hinging, provide a really strong base of support so that when we do a dynamic movement, there's minimal, right, movement, particularly through the lower back area. So these three exercises that, again, Stuart McGill has come up with, I'm going to go through here. So the first one is called a curl up, right? So the idea here, you're going to place your hand under your lower back, okay? You're going to place your hand on your head here, and the exercise essentially is to curl up and do a little isometric contraction of the muscles in the anterior portion of the abdominal area, and typically you want to hold this for a good 10 seconds or so. And then we would switch legs, Okay, and again, what you're working on here is anterior or frontal stability in through the abdominal area. Okay, and again, this is to help stabilize those different segments. And then you would switch hands. And by the way, with all of these exercises, what we're trying to accomplish here is you're actually trying to maintain the spine in very much a neutral position. So this is the whole key, is when we're doing these exercises, the spine, the natural curvature in the spine stays neutral. Okay, so we don't want to, for example, have the pelvis move, or we don't want to produce any sort of, like a lot of times when somebody does a curl up like that, they might fall into more of a posterior pelvic tilt, where basically their lower back is flattening. The key is, with all of this, the pelvis stays neutral. We stay, in terms of the back, it stays very, very stable, and there's not a lot of movement at all. Typically no movement whatsoever in these 3 different exercises. So that's exercise 1. It's called the curl up. The next one is the cat dog. So with this one here, right, we're starting in, again, neutral. So the lower back is in a slightly extended position. I'm going to do a little push down with my hands. Now what this does is this activates serratus anterior, which helps to, again, minimize movement through the thoracic spine region. And then what I'm going to start with here is just, again, no movement whatsoever in the back, very minimal. And I'm going to try and lift up the one leg. I'm going to bring that down. And then I'm going to do the opposite side. And so again, before I do the movement, I'm actually thinking about setting those abdominal muscles. I'm squeezing, I'm bringing my abdominals up towards my spine to stabilize that segment. Now I'm adding in, right? I'm adding in that leg lift. My back does not move, very minimal, right? So we don't want to see, right, some arching through here, right? I don't want to see rotations through the spine at all. Everything in the spine stays perfectly still. And I'm shaking here, like I'm working really hard to maintain this. Then from there, right, same sort of idea, I'm going to lift up the individual arms. Again, I'm maintaining my back in a neutral position. There's no movement through here. Okay? Finally, right, you would actually alternate arms and legs. So I like to break these down, right? And so depending on how much movement the individual is starting with, we might only be able to start with just barely lifting up the leg, right? Isolating the arm. So it really depends on that starting position for the patient. And then finally, we're going to go into a side plank, okay? So you're on your side here. You might want to start with a modified side plank where essentially you're just on your knees here, and I'm lifting myself up, okay? I'm setting my abdominal muscles. There's no movement, right? So I'm stable through here. This is going to work on stabilizing with any sort of lateral movement. So we don't want it, again, any lateral shear through the spinal segment. And you would then do the opposite side, and you can work towards, right, a full plank on the toes. Okay? And typically with those, I like to hold those for a good 30 seconds to a minute, 3 to 4 times. So those are what's referred to as the McGill Big 3. The recommendation typically with this is to do this exercise once a day, right? So it's a daily exercise, and it's also a great exercise to do. McGill also mentions that it's a great exercise to do before a workout program. So, right, so we want to basically stabilize our whole spine here before we go into any sort of dynamic movements that involve, right, the limbs, the legs. We want to be strong through here first, particularly, right, when somebody has a lot of movement or instability through the spine, or hinging as we talked about. If you have any questions or concerns, feel free to leave a comment below, and thanks for watching my video. Have a great day. Take care.